Is there really a safe level of tobacco use, or any exposure to tobacco is harmful?
Any exposure to tobacco is harmful.
So tobacco is often linked with multiple cancers.
So having an alcohol, it is like adding a fuel to fire.
So when it comes to cancer treatment, how do you decide that surgery would be the best option?
Stage 1 or stage 2 is very likely that they will directly go for surgery.
How important it is, or how do you find surgery is the best approach instead of going for chemotherapies?
Whereas some cancers may be treated with radiation, then followed by surgery.
What is the one thing that the patient often wish that they would have come earlier?
Because they're not aware of what the symptoms were, or they have feared to reach out.
So how can it be detected earlier?
Reducing the number of cuts which are given on outside of the body. Most of the patients, unfortunately, in our country are coming at a later stage than we would have expected. Simple. Quit tobacco.
Hello, this is Neha and welcome to Lilavati Hospital's official podcast series, where we bring you one step closer to expertise, innovation and patient care that define our institution. In today's episode, we are discussing about a topic that affects millions of lives, that is cancer awareness, cancer treatment, and the modalities that can bring a better outcome. At Lilavati Hospital, cancer care is driven by clinical expertise, treatment modalities, and highly advanced techniques. Joining us today, we have Dr. Deepak Chhabra, a highly experienced oncologist, especially in abdominal and gastrointestinal cancers. Before we get into the discussion, I'd love for our listeners to get to know you better, sir. Could you please briefly introduce yourself and your area of expertise?
My name is Dr. Deepak Chhabra. I'm a consultant cancer surgeon at this prestigious institute called the Lilavati Hospital and Research Center. I've been affiliated with this hospital since the year 2003 and have treated a vast number of cancer surgeries, which automatically goes to say the amount of experience that the hospital has and we as doctors have in treating the cancer patients. I'm a cancer surgeon, and of course, I will be discussing with you modalities of awareness of cancer and probably the surgical aspects of the cancer.
Yes, sir, we are very fortunate to have you here. So, beginning with the topics, we would like to know what are the most common cancers that you have been treating till now or you have come across?
So being a specialized unit treating gastrointestinal cancers, majority of patients come with abdominal cancers. Now for a patient, this is an abdomen, but the abdomen is basically like a Pandora's box. And when you open this box, you get various organs in it. There are organs like liver, there are organs like pancreas, organs like the adrenal glands, organs like the intestines. So being a focused gastrointestinal unit, I'm dealing with a lot of cancers of the gastrointestinal tract, right? Which starts from swallowing, which means the cancers of the food pipe, or the esophagus, the cancers of the stomach, which we call as gastric cancers, the cancers of the liver, bile duct and pancreas, commonly labeled as the hepatobiliary and pancreatic cancers, cancers of the intestines, which are mainly the colorectal cancers. Colon is the large intestine, rectum is the terminal portion of the large intestine called as the rectal cancers. Apart from that, being a specialized cancer unit, there are a lot of other cancers that we generally deal with, which can be breast cancers and the oral cancers. And of course, the oral cancers are taken care of by different colleagues of the department.
Yes, sir. So the information that you gave has given us a good clarity about the prevalence of cancers. So we'll talk about the risk factors. So what are the risk factors? Most of the cancers, when people come to the consultations, they are coming at the stage of third stage cancer or fourth stage cancers. So how can it be detected earlier?
So we need to understand that no cancer just suddenly develops in a day. We need to be aware about symptoms, and that is where the entire awareness comes up to. And when we talk about awareness, what do we need to be aware about it? We need to be aware about certain what is called as warning signs of cancer. Now, what are these warning signs of cancer? If I have to sum up in 5 or 6 criteria, one is that if somebody has an abnormal weight loss, which it is unintentional, you've not intentionally decided to lose your weight and you're just having a weight loss over a period of time. You have alternating or what we call as altered bowel habits. When you say altered bowel habits, that means you may either have a constipation or a diarrhea, But mind you, it is not something which is persisting for a day. It is a change over a period of time, that you have been well so far and suddenly you have been facing these bouts of diarrhea as well as facing these bouts of constipation over a period of time, which could be a cancerous kind of a presentation. The third thing which you need to be aware about is if you're feeling persistently weak, that means probably you are losing blood somewhere. And if you're losing blood in your stools, you find that there are black colored stools, or if you have vomited blood, then those could be signs of cancers. If you have noticed some kind of lumps, and these specifically go in the region of the breast for all the women, if you detect that there could be some kind of a lump that you're feeling, please reach out to the doctors so that it's not too late when it's developed a cancer. Generally, lumps do develop in the abdomen, but it's very difficult to feel that particular lump because you always feel it as a bloating. And I have seen these common bloats happening in patients who are suffering from ovarian cancers, especially the women who have got ovarian cancers, and suddenly you have fluid filled in your tummy and you are completely bloated, and you always attribute this particular bloating to either an indigestion or some form of an acidity, or probably something else which you come across as a routine case in your routine lifestyle. The last factor is all of this, which probably contributes, is also the intake of tobacco and alcohol. So these could be certain factors which could be responsible for, understanding the signs and symptoms. So if you're somebody who's using tobacco or who's smoking very regularly, if you develop ulcers in your mouth, a long-standing ulcer or any kind of non-healing ulcer, that can itself be a cause or a symptom which can drive you to detecting a cancer.
So how does surgical approach takes place in this kind of treatment while treating a cancer? So how important it is, or how do you find that surgery is the best approach instead of going for chemotherapies and other modalities?
So today you have three modalities as what you have highlighted. The three modalities are surgery, chemotherapy and radiation. We need to understand what are these three modalities. By surgery, which means to cut open into the body and remove some cancers and make a treatment. Chemotherapy is something which is going through the IV route. That means the way you use saline. Saline is given into your body, and certain specialized drugs against cancer are given, which are called as chemotherapy. And then people often confuse chemotherapy and radiation therapy. Radiation therapy is something which means giving you an external dose of light to kind of kill a particular kind of a tumor or the cancer. Now, your question pertains to about surgery. I would always say that surgery is the best form of treatment for solid organ cancers. And by solid organ cancers, it means a cancer of a particular organ. Say, for example, a cancer of the pancreas, a cancer of the intestine, a cancer of the liver. These are the solid organs. So we need to kind of curtail, or what you call as give a personalized kind of a treatment for cancers which are solid cancers. When it comes to liquid cancers, that means cancers which belong to the blood, or the blood cancers which are often called as leukemias and lymphomas. These are the cancers which will often get treated with chemotherapy alone without requiring a surgery. Now, having said that, when we are talking about solid organ cancers, we often get into what is called as a multidisciplinary approach. That means some cancers may be treated with chemotherapy, then followed by surgeries, whereas some cancers may be treated with radiation, then followed by surgery. And there are some cancers which are actually treated by surgery at the beginning and then followed by chemotherapy and radiation therapy.
Yes, sir, that truly highlights the timely diagnosis, how important it is in the early detection of cancer. So we would like to know what are the risk factors that are contributing to such types of cancer.
So as I already highlighted, the major risk factors will always be fallen into two categories. One which is called as the modifiable risk factors, and the other which are called as the non-modifiable risk factors. When I say non-modifiable risk factors, the non-modifiable risk factors are age. Sometimes the cancers develop because you're aging. So we can sometimes see cancers in people over 70, 75 and 80 years of age, and probably because they've aged, the immune system has gone a little weak and patients develop cancer. Now, you can't modify that particular thing. You can't modify an age. The second non-modifiable risk factor is what is called as genetics. So when you have somebody in a family who's having cancers, There are some families like breast cancers or intestinal cancers which can run into hereditary. So somebody's mother, somebody's father, somebody's grandfather, somebody's maternal aunt, somebody's paternal cousin, they are having cancers. You automatically become at a high risk factor, a high risk individual for developing a cancer. So these are certain non-modifiable risk factors. What are the modifiable risk factors? The modifiable risk factors is our consumption of tobacco, consumption of alcohol, consumption of not a very good balanced diet. That means a diet which is not so healthy, which is not so good in the nutrients, lack of sleep, lack of physical exercise, and stress.
So ultimately, lifestyle modification is one of the important factors
Of
that
course.
would contribute.
Of course, that goes without saying. Lifestyle modification is one of the very big factors that can contribute to preventing the risks of developing a cancer.
So you might have seen many people coming to you for consultation. So at what stage do you find people coming to you?
So most of the patients, unfortunately, in our country are coming at an advanced or a little later stage than we would have expected them to come. So if you have to put cancer stages, there are 4 stages of cancer. Stage 1 is the earliest cancer stage, and stage 4 is a stage where the cancer has already spread from one organ to another organ. Let me give you an example. If you have a cancer which is started in the intestine, and by the time you have reached out to the hospital or to the doctor for treatment, and we realize from various modalities of scans that your cancer has already developed into different places apart from the intestines and also gone into the lungs and the liver, that becomes what is called as a stage 4 cancer. So we see most of the patients coming to us in at least beyond stage 2, and most of the cancers will fall into a stage 3 category of cancers.
So you said that most of the people come to you beyond stage 2. So what are the factors that are allowing people to come after stage 2? Like how are they not able to identify it earlier?
So it is very common, and I'll give you a very simple example. Let's say, for example, today if I have got a cramp in my abdomen, I would generally not think in terms of a cancer, and I don't blame you for it. If I get a cramp, I will probably relate it to maybe I've had some food outside, maybe last night I had a party, I went to my friend's place, this is not something which is usual that I've eaten, and I would generally take some kind of a paracetamol or some kind of medicine and say that I'm better. But if the same cramp keeps on repeating to me over a period of next 2 weeks, 3 weeks, and especially associated with some kind of disturbance in my bowel habits, either I'm getting a constipation or a diarrhea, then this should bring you to the doctor. Unfortunately, we are always taking this as either an acidity or a bloating. So the bottom line, what I'm trying to say is reach out with your symptoms to the doctor, however small they may be, because you are looking and preventing something which is very big. Now, I'm not saying that every intestinal cramp needs to reach out to the doctors. What I'm trying to tell you is you have to understand that if you are having blood in stools, if you have unexplained weight loss, if you have these kind of habits which is persisting, this is a recent change, but this is persisting over a period of time. So many of the times when you're looking at symptoms, the symptoms are always there. When we look at the patients and we are looking into the history of the patients do have a history which dates back to about 5 or 6 months earlier on. And that is when we realize that they already had the symptoms of the cancerous. It is just that we were not aware about those symptoms. So awareness is the key factor to understand what kind of symptoms you are having so as to get to the hospital or the treating doctors.
Surely now our viewers might have been aware about what are the symptoms, the risk factors, and surely they will be able to detect it at an earlier stage. But sir, if somebody comes at an earlier stage and somebody is coming at 4th stage, so does that affect the treatment that they get?
Of course. So when we talk about cancers, we are always looking at the only question that has been asked to me is, will my patient be cured? So I always tell people that cancer is a journey. It's not a one-step treatment. It's a journey from what we call as control to cure. That means right now you've got a cancer which has got developed in your body. We need to understand to what extent it has spread. And to now prevent that spread of the cancer, we need to get that particular cancer into control. Now, once we have that control by modalities of treatment as highlighted, whether it's surgery, it's chemotherapy or radiation therapy, that is when we would want to keep a routine check once in every 3 or 4 months to make sure or to understand how the cancer is behaving over a period of time. So to answer your questions, what is the difference of people that we notice, somebody who's coming at an early stage versus somebody who's coming at a later stage? We are talking about life survivals. So somebody who's coming to us at a stage 1 or stage 2 of cancer definitely lives longer than somebody who's coming to us at a stage 3 or a stage 4. And I'm not saying that somebody who's coming to us at a stage 3 cannot live longer. Of course, you can live the same way as people with stage 1 or 2 live, but the modalities of treatment need to be followed very diligently and very seriously over a period of time for us to help you out better. Unfortunately, for people who are in a stage 4 cancer, there are modalities of treatment, what is called as palliative treatment. That means we can support you till to the best of our abilities to keep your symptoms under control, but we may never be able to cure it. So our idea should be to reach out early rather than to come at a stage 4 or what we call as an advanced disease.
Yes, sir, that's quite eye-opening, and it has highlighted why early detection is very important in managing cancer. So from your experience, what is the one thing that patient often wish that they would have come earlier?
Yes, so after treating thousands of cancer patients and when they realize at to what stage they have come in, they only wished that had they been aware about their symptoms and had they had the sense to come to the hospital early to have been detected. Many patients are aware, many patients do understand that something has gone wrong, but there is a fear. So I think the two things which patient always regret is, one is lack of awareness of symptoms, because they're not aware of what the symptoms were, or they have feared to reach out because they know for the fact that something's wrong, but if we get to treatment, maybe we'll suffer more, and that is when they don't come. So fear and lack of symptoms. These are the two things which I always tell people that don't be afraid of to reach out.
So now, as you have clarified about the risk factors, the treatment modalities, I'm sure that our viewers will not fear anymore to come and consult you here at Lilavati Hospitals, as we have one of the best doctors with us today. Next thing, so when it comes to cancer treatment, how do you decide that surgery would be the best option?
Of course, we run a series of tests, and as I said that we clearly identify the patients who have got solid cancers versus liquid cancers, and I'm giving you examples of, let's say for example, an abdominal cancer, or let's say a pancreatic cancer. Cancers like these can come with jaundice. So sometimes a patient who's coming with jaundice gets detected a little early because it's affecting your day-to-day life. You suddenly start seeing yellowness in your eyes. You suddenly realize that your digestive or the appetite is going low. Then we run a couple of scans which may involve a CT scan and sophisticated PET scans. And we may also want to do some kind of endoscopy and biopsies. And by biopsy, I mean that by whichever route, either through the skin or through the endoscopes, we take a small chunk of tissue for a diagnosis. And once we have diagnosed that this is a particular type of cancer, we look into the scans in detail. We look into the PET scans. We have newer modalities of investigations. And with all those investigations, we are able to formulate what is called as a stage of the disease. So any cancer patient from a stage 1 to stage 3 always gets into some form of surgery when it comes to solid cancers. Now, it is only sequencing. How do we sequence these cancers? As I said, stage 1 or stage 2 is very likely that they will directly go for surgery. Some cancers which are at stage 3 in certain organs, it is likely that we may want to give you chemotherapy to control it a little better and then probably act on the cancers. And I'll give you a very simple corollary in a day-to-day life. Let's say, for example, if we have a house full of cockroaches and you pick up a broom and you want to kind of hit the cockroaches, they're going to spread all over. And now you don't want them to spread. So what you're going to do, you're going to put an insecticide or a repellent first to decrease their activity, first to kind of make them a little slow down on your pace. So you slow down their pace and you're able to kind of sweep them easily. So that's what the chemotherapy does. Sometimes it decreases the activity of the cancers, even in the solid organs, and then we may want to operate those so that by the time we are operating and by the time you're recovering, there are no major cells which are creating a havoc somewhere outside of the organs. So this is where we juggle between how to decide between surgery versus no surgery versus deciding which form of treatment goes to which patients. But the backbone of solid cancers is surgery.
Okay, so now that we have talked about surgeries, there are robotic surgeries and there are many minimal invasive surgeries. So how does it affect the outcome?
Today is the world where everybody wants a minimal invasive surgery. That means you are looking at surgery which is done by specific instruments which do not give you a major cut. Now, what is the corollary behind? The corollary behind it is that whenever I give you a bigger cut, the bigger cut is going to give you more pain. So the biggest advantage of minimal invasive surgeries are we are reducing the number of cuts which are given on outside of the body. Now, are we doing anything different inside by doing robotic surgeries or by doing laparoscopic surgeries? We are doing the same thing. If I open you up and I have to remove this much amount of tissue and organ for a cancer, I'm not doing a lesser job by doing a laparoscopic or a robotic surgery. So where is the advantage? The bigger advantages comes is easy access to these particular instrumentation and a training in these particular things gives us a way to perform these surgeries in a manner which goes with minimal cuts. That means you're not giving a major cut to the body, and because of which the recovery seems to be faster. We've had patients who have gone out of the hospitals after 12 and 13 days after a major cut open surgery, but the same patients are going home within about 4 to 5 or 6 days. So it is reducing the number of stays, it is reducing the pain. Is it helping the doctors? It is also helping the doctors because we are seeing things in a much more magnified view when we are seeing with a robotic and when we are seeing with a laparoscopic instrument. It is also helping our entire team of treatment. Imagine if I am as a surgeon operating in the abdomen and one of my assistant has to look into the abdomen. We are just two people who are, and sometimes the head hits each other and we are not able to kind of see well certain things. The staff nurse or somebody who's assisting us is not able to help us out well. But when the same thing is kind of projected on a screen, the entire team is also aware about what is going to happen next and what is the next instrument which the surgeon is going to require. So I think it is helping in a manner where it is helping the doctors to perform a much more magnified viewed surgery. You see it better and you perform better. It is helping the patients to return to home faster as well as have minimal cuts.
So basically it is patient friendly and multidisciplinary collaboration also
Definitely.
plays an important role.
You can definitely say, but again, as I said, that is it for all the patients? Answer is no. Sometimes you have to understand that when we are operating on tumors which are big enough, these are the tumors which are not necessarily handled well by these pointed laparoscopy as well as robotic instruments. So open surgery is not no rule. Open surgery is still a way of doing a cancer surgery. So it's up to the prerogative of your surgeon. And I would always say that don't go by the market or the gimmicks which will tell you that no, this must be done by laparoscopy or this must be done by robotic. Trust your surgeons. They will do definitely a better job for you. Let them decide whether it's open, robotic or laparoscopic for you.
Yes, sir. Surely trusting the doctors and the consultants for whom people come here for consultations, that's very important. Now we'll talk about the prevention. People are aware about the risk factors and the diagnosis and the treatment modalities, but for those who are not aware, how can they prevent?
Awareness is one part of the story. When you are aware that these are the things which are responsible or these are the symptoms which could be cancers. Now today you don't have symptoms. That means that let's start living healthy. That means we are looking at a healthy lifestyle. We're looking at absolutely no tobacco in any form. We are looking at avoiding smoking in any form. We are looking at limiting our alcohol use, which does not mean bring it down to absolute zero, but as I said, limit it to only social drinking once or twice, maybe in about 3 months is decent enough, and you cannot have the social drinking once in every week or twice in every week. So cut down on the alcohols. Have a very well balanced but a nutritional diet, which means a diet which is full of antioxidants. Don't take all these over-the-counter junk foods, which are too much of fried, too much of oily foods. Have fresh fruits and have vegetables. And when I say fresh fruits, these generally need to be seasonal vegetables. You can't have apples in the month of, say, March or April, because that's not the season for apples in our country. They would generally be frozen by the time they come. So eat fruits which would generally then be the recent fruits, which are like the melons or the water-filled fruits which comes during the summer times. So when I talk about fresh fruits and vegetables, I'm talking about seasonal fruits and vegetables, right? You're living a healthy lifestyle. That means pay a stress to your sleep, put some form of exercise into your daily routine. That means even walking for about 20 to 30 minutes every day, irrespective whether you're in a corporate job, you are in a business profession, you're a laborer, you are on a desk job, do whatever, but give that 30 minutes or 40 minutes to your daily routine, which cuts down your risks of developing a cancer in future life. Of course, as I said, that if you have somebody who is in the family who's already had a cancerous process, and of course you don't have symptoms, be aware about it. Today there are also certain kind of genetic tests which can bring out certain genetic variants in your blood reports to suggest that you may have a risk of developing a cancer in a lifetime. And I'm talking about especially for patients with breast cancers. There are BRCA studies and there are other genetic variants which can be detected in your blood or the saliva, which possibly can tell you that you are at a risk of developing a cancer. Today, we are also going one step forward, doing what is called as RRS, which is called as the risk reduction of surgeries, risk reducing surgeries rather. What is this risk reducing surgery? Let's say, for example, if your mother and your aunt had a breast cancer, and now we are screening you and you don't have anything, and you have 2 or 3 generations which are having these kind of cancers, then you are at a higher risk, with, of course, backed up with your genetic test result, that you may be at a high risk of developing a breast or a uterus or an ovarian cancer. And then we may ask you to go through a surgery for removal of the uterus and the ovaries and probably the breast, so as to reduce your risk of development of cancer in the future.
Yes, sir, those were very simple tips, yet very useful and very impactful tips in preventing the risk of cancers. So you said that tobacco and alcohol are one of the major factors that are in the prevalence of cancers. So tobacco is often linked with multiple cancers. So it's like a cancer-causing agent. Is it true, or it's just a myth?
There have been various studies which have proven beyond doubt that tobacco in a direct form is responsible for development of cancers. Now, what does tobacco do? People take tobacco in a couple of forms. That means either they smoke tobacco or they chew tobacco. You see a lot of people having these packed, what you call as ingredients, which are filled with tobaccos, and they either would keep it under the cheekbones, or they would keep it inside of the mouth and on the tongue. So what happens is the agents which are in this particular thing, whether you call it nicotine or whatever is in the tobacco, these are all called as carcinogenic agents. And what is these agents? That means they are some things which can develop into cancer, which can develop normal cells to get into a cancerous kind of a cell there. And once they develop a cancer, you will then start having cancers, not only at one, probably at multiple places, because it does what is called as a field change. That means when you are smoking, the smoke is just not touching your cheeks. The smoke is also getting onto your tongue, the back of the throat, the lining of the nose. So it can cause a field change of the entire mucosa. So we are aware about it, that we have seen patients who have been treated with one form of cancer, say for example oral cancers, because of a long-standing tobacco habit. They have also developed cancers of the food pipe. They've also developed cancers of the voice box. They've also developed a different kind of cancer in some other part of the throat. So these are the cancers. So we are aware about it, that there is a direct link of tobacco to cancers. And to add to it, if you are also having an alcohol, it is like adding a fuel to fire. So if you have a spark somewhere, and if you add an oil to it, the spark is definitely going to get developed into a fire. So that's where the tobacco as well as the alcohol come into the whole armamentarium of causing a cancer.
Is there really a safe level of tobacco use, or any exposure to tobacco is harmful?
Any exposure to tobacco is harmful, that is for sure. There is nothing like putting a safe level to tobacco or a safe level to alcohol. Again, as I said, that these are all genetically timed individuals. If we have seen patients who have smoked tobaccos and who have smoked cigarettes for 40 and 50 years and have not developed any kind of cancers, but we have also seen younger college-going individuals who have started smoking recently, and within about 5 or 10 years, they've developed cancers. So unfortunate, but you cannot ask me to put down a safe level for tobacco and alcohol, because we're dealing with a lot of cancer surgeries. We are seeing a lot of patients going through the trauma of going through these mutilating surgeries. I would definitely put a no to tobacco and alcohol.
That was really a very good clarification of the use of tobacco, whether it is a myth or is an important factor in getting cancers. So, sir, as World Tobacco Day is near, what message would you like to share with people who are currently in use of tobacco?
So you have to understand that when I'm talking about tobacco use, though it is frequently the cause of most of the oral cancers, it is frequently the cause of throat cancers. Tobacco use is also the cause of cancers of the food pipe. Tobacco use can also be a part of your healing process. So when you're going through any kind of healing and any form of tobacco intake, the way diabetes affects your healing, tobacco will affect your healing processes. So for all those people who are presently smoking or having tobacco, my advice to them is quit tobacco. Simple, quit tobacco. I think it only needs your mindset. You did not need somebody to tell you that you need to smoke. You did not need somebody to tell you to chew a tobacco. You don't need somebody to tell you to stop it. So you are the one who are responsible for yourself. You have to just make a decision. So make a decision. Sometimes, yes, I understand it is an addictive phenomenon, and because you're addicted to it, you feel a little restless. If that is happening, cut it down. If you're smoking 10 cigarettes a day, bring it down to 4, bring it down to 3. I'm not saying suddenly quit it, but do a gradual quitting. And you definitely have de-addiction centers. You can always visit and take help of de-addiction centers, because help is always available at hand. So just quit.
That's a powerful message, and I'm sure many of us will resonate with it.
Thank you so much. It was my pleasure to give you this health awareness talk today. And I'm sure many people should reach out and would reach out to the hospitals and get yourselves screened through various health checkups and the packages that may be available at the hospital. Don't specifically look at cancer packages. There are no particular tests which will detect your cancers, but do the tests which generally tell you that you are healthy. If we find any abnormal tests, leave it to the doctors. We will tell you what needs to be done beyond that. Don't specifically look out for cancers. Watch out for your symptoms.
Thank you, doctor, for sharing your valuable thoughts and your information with us. That was truly an insightful session, and I hope our viewers have got true information and they might benefit from it. Thank you for tuning in. We'll be back with more conversations that matters.